It's going to be emotionally hard, but you want to think of the most struggles. You want to see yourself to some extent, someone who needs as much help as possible, because that's how they're going to be reading it. Think of it from their perspective. If they're reading the application and they cannot appreciate your need, and you're like, oh, you're doing well. You have been able to have coping strategies. You've been able to pass all the way to medical school. You don't need accommodations. Next. So you really want to emphasize this struggle. They responded, we need to see specific DSM criteria and break it down of specifically how you need each individual one. I am so thankful. Whoever was the person who read my accommodation, they gave me that option. Most of the time, people just deny them and don't explain why. So this is why I've been trying to educate everyone I can. If it's a mental health condition, go to the DSM and write it all out. What I've noticed about all these exams, the passing score is usually 2 standard deviations below. Now I like to say a standard deviation beyond passing. And you will see when you do the practice exams what the standard deviation, then you get to practice statistics. So if you pass, try to be at a standard deviation of a -1, because a -2 would be passing. So if you can hit a -1, that's an increased chance that you're going to pass. And then that can bring in all, no matter what happens that day, anxiety attack, whatever happens, you have that buffer zone.
I'm so honored to have you here, Dr. Moss. A few of our club members have been nicely guided by your materials, particularly as we're seeking accommodations for boards and thinking about intersections of disability and medicine. We're honored to have you here. I'm excited to hear your talk.
Oh, thank you so much. I'm happy to be here and to connect with individuals all across the country. I grew up in Colorado, so closer to you guys normally than right now. I'm in Chicago, a little bit farther. Thank you again for inviting me, and I'm glad to help individuals who are applying for accommodations. I hope that this helps. So my name is Stephanie Moss, Dr. Moss, and I am a PGY2 psychiatry resident at Rosin Franklin and in North Chicago. And then I'm also the chief resident for medical student education. This is where my heart is, to help others, because I struggled quite a bit through my medical school journey. Hopefully you can learn from my mistakes and struggles so you don't have to struggle as much. Starting with disclosures, I want to mention that I am sharing my personal lens and experience based on my own identities of being a Mexican American, a first-generation doctor, a married heterosexual cis female woman with invisible disabilities, which include complex PTSD, generalized anxiety disorder, endometriosis, and interstitial cystitis. And if you haven't heard of all those yet, you will for step 1. Or at least for your OB-GYN rotation and your psych rotation. So as an overview, we'll be going over first the definition of a disability. Then we'll talk about what disability in medicine looks like, what does it look like right now, what versus in the past, and then I'll be sharing my own journey, trying to figure out what are accommodations and disabilities and how does this fit into my own journey. And then we'll be going over specifically how to apply for accommodations for COMLEX and USMLE. Now, I was an MD student, so my experience is mostly USMLE. However, I've helped individuals going through both USMLE and COMLEX, and they're pretty, in general, similar concepts, so that's the lens I have. We'll be even more specific on what to include in that personal statement for the accommodations, what you should ask your providers to say in their letters. If we have time, I'll also briefly mention what does it look like when you eventually apply for residency, some things that you should consider during the application, interview, and ranking system. Also, lastly, talk about the laws and protections that you have and why we need you in medicine. So first, what is a disability? So I liked this definition, which is from the ADHD Americans with Disabilities Act. A person who has a physical or mental impairment that substantially limits one or more major life activities, a person who has a history or a record of such impairment, or a person who is perceived by others as having such impairment. Now that's all the blah, blah, blah. This is my definition. A physical or mental health condition that limits your ability to be the best you can be, whether in academics, relationships, or life in general. Disability in medicine. This is the medical school graduation questionnaire. You do this after your first year of medical school and after your second year of medical school, and then you do it at the end of medical school. So like right after you graduate. It's by the AAMC, and it's an optional survey, but it provides a lot of good information. One of the things I always keep my eye on every year is how individuals are disclosing on this anonymous survey that they have a disability. Just this past year, the ones that graduated and are starting their first year of residency, 12.7% said yes to having some sort of disability. Now, I want to compare that back. Just you can see what 4 or 5 years ago, 8.3. So already a substantial increase. Now, I don't know if this is we don't know if this is because people are more willing to disclose that they have a disability, more are getting accepted, or more are realizing they have disability. I don't know the reason, but this is interesting to note that it's becoming more and more common to graduate with a disability. Then looking at specifically the ones that they disclosed, the highest number is ADHD, attention deficit or hyperactivity disorder. Next, at 16%, is a chronic health disability, and that encompasses so many. Pretty much just like all the things in medical school, could have been any of them. Deaf or hard of hearing, then learning disability. Oh, I actually skipped over. I thought they had it in order, but no, they don't. Psychological disability or mental health disability at 12.8%. So that was number 3 as most common. And then all these other ones, around 2,141 total. I took this information, and since I actually took a leave of absence myself during medical school to take care of my own health conditions, take care of my own like USMLE journey, I've been helping medical students get more research on who are these people taking leaves of absences. And this is the most recent survey that came back with 59 students from medical schools across the country. I thought it was super interesting that around 70.7% of the individuals who responded identified as a female, 48.7% as Hispanic Latinx, and then a significant, you can see also 80% identified as a underrepresented medicine, whether that's first generation, race, or disability. And then the ones that said they did have a disability or chronic illness, a significant amount said they had ADHD, and then about half said specifically any type of mental illness. So if you yourself have taken a leave of absence, we would love to hear your experience. This is the QR code to a survey that we're trying to hit 100 individuals. We're currently at 70, so we're so close. We're working with Tufts University to get as much information as possible. If you also fill out the survey, they got a grant to actually give you a gift card. So please share that QR code so we can get to 100, so we can get a lot of statistical significance. And I'll also share that at the end. Okay. I love Brene Brown. I really got into her when I was in my leave of absence and going through my own journey. One quote really meant a lot to me. There's power in being vulnerable. So I'll be going over my own journey. So I mentioned it already a little bit, but M1 year, went to Chicago. I'm from Colorado, like I said. My husband and I both went to medical school together. In March of my first year of my M1 year, COVID hit. So then we moved all virtual classes all from the second half of M1 year and all during M2 year. During that time, I also failed multiple blocks, got diagnosed with health conditions, dedicated. And I struggled to pass that step 1 exam. I could not get those scores up for just my practice exam. I ended up being highly encouraged by my school to take leave of absence. So I took a leave of absence. At that time, I eventually took the exam. I failed it. And one of my good friends, she said, "Hey, didn't you just get diagnosed with all these health conditions and mental health conditions? Didn't you know that you qualify for accommodations?" And I was like, I don't think so. I've never received accommodations before in my life. I don't have a disability, because in my mind, I thought disability was something you could physically see. And so I did not identify with that at that point in time. It took me moments to get over that and be like, oh, actually, it's okay to ask for help. It's okay to have additional needs. That doesn't mean anything that I shouldn't be in medical school or that I shouldn't be able to pass. It just means I need additional help to be able to pass. So I did apply for accommodations. I originally asked for time and a half and break time. They denied the time and a half because I did not have any previous history, but they gave me a break. So I took that break, that extra break time, did it again, failed again, and then eventually I passed it the second time. Third year, I applied for accommodations through my school. This, I'm learning even more what accommodations are, what it means to have accommodations, how to actually ask for it, how to improve my personal statement, improve my application to really show that need of why this during step 2, why I really needed that additional time, not just the breaks. The breaks were awesome for being able to reset my mind, go to the bathroom, eat a snack, because I didn't have enough time. You know, you're running in and out. But I really wanted to get that more support. So eventually I did reapply, having that additional improvement on my USMLE application. This time I really got to learn, okay, what specifically do they want? What do they not want? The first time during my step 2, I applied. Thankfully, they didn't deny it right away. They actually said, we need more specific information for the DSM criteria on each DSM criteria that you have. And so already I'm learning they want as specific as possible. And that's finally where they approved my extended time. Fortunately, they only gave me time and a quarter, but it was something. Then in 4-year, dual applied psych and family, disclosed my applications, and just this past week, I took step 3. Normally, step 3 is broken up into 2 days. I split it up into 4 days. Instead of 9 and 10-hour days, I did 5, 6-hour days, which was so much better. Time and a quarter, and then double break time. I failed it the first time, and hopefully, knock on wood, this will be it. I'll have that perspective of applying for accommodations for step 3 or COMLEX 3. Okay, let's get in. I shared a little, but let's really get into specifics. First off is sharing your personal statements. I broke this down. Make sure that you include your ID because you're going to be emailing it. I'm not sure 100% if it's also for COMLEX that you email, but I think so. So be very specific at the beginning. This is my personal statement. I'm requesting what you're specifically requesting, and then I'll go over the options in a moment. Whether that's extra break time, extra testing days, broken up, whatever. My specific diagnoses, and I found that they even like to have your codes, which the doctor should have, and if they don't, you can easily look on Google. What is generalized anxieties code? It's the billing code. But they really like that for some reason. And then I like to put, these are the specific things I'm going to be including in this application. For some reason, they are more likely to accept if it has an MD or DO letter. I don't know, I'm not them, but I'm saying from now helping dozens of individuals that get denied, individuals that don't get denied or have struggle, the ones that are more likely have some sort of letters from the MD or DO. And this could be your family practitioner, like your PCP. This can be, for my an OB-GYN, a PM&R doctor, a urologist, like any type of, they just like to see that MD-DO. Next, from a therapist. That could be a mental health therapist or physical therapist, physical therapy, occupational therapy, behavioral therapy. It's just, additional lens to really help to say, to kind of validate what you're saying in your personal statement. Next, letter from the accommodations department at your school, whether or not you receive accommodations and what they specifically are. Like if you get them all for your exams, for your anatomy exams, it's great to include that. And then this is the thing that always becomes a little bit more challenging, including letters of accommodations from your previous school. Now, most of us, like myself, do not have that. But if you do, amazing. So that can be the MCAT, that can be ACT, SAT, but then it can also be the opposite. It can be if you have failures or extremely low scores. I've had medical students include those to share like justification, like I had to take the MCAT 4 times until I passed the exam. If you didn't have accommodations, including those previous exam scores can be additional evidence. They love evidence. Any type of testing. No, you do not need a neuropsych exam. If you have it, amazing. If you don't, do not worry about it unless maybe you apply and they deny you and say they want it specifically. We have to look at the reality. It's really hard to get into the neuropsych exams and very expensive. See what you can acquire without doing that neuropsych exam. That includes speaking to a psychiatrist. A lot of times we can diagnose these things with the DSM. We don't need the neuropsych 8-hour exams. We can diagnose it just by talking to you. If you have stuff, amazing. Another things could be imaging labs. So maybe let's say you had a head injury and you can include the MRI to show that you had the head injury, to show that's why you have headaches and that's why you need more time because you could get headaches in the exam. I don't know. Stuff like that. There's always, the more data you have, the better, I've noticed. Okay. This is where we get into the nitty-gritty that I feel like not enough people include in their personal statements. And I understand why. Because this is hard. Up to this point in our life, we've been taught to be strong, to hide our struggles, to see the positive. I loved one of my accommodations advisors. She told me, you need to look at the opposite. And it's going to be emotionally hard, but you want to think of the most difficult and most struggles. You want to see yourself to some extent by someone who needs as much help as possible because that's how they're going to be reading it. Think of it from their perspective. If they're reading the application and they cannot appreciate your need and you're like, oh, you're doing well. You have been able to have coping strategies. You've been able to pass all the way to medical school. You don't need accommodations. Next. So you really want to emphasize this struggle. I'm not saying to lie. I'm saying to move beyond your ego and see yourself for that sort of, you want to see yourself from that lens of what did I struggle with? This could be going all the way back to high school, all the way back to pre-med, thinking about how it felt to sit in those exams. You think of any type of emotions and physical pains, physical manifestations of anxiety, increased heart rate, increased breath, like all those physical and emotional signs, by actually writing that in your personal statement will really help you get approved. Specifically, this one's really big, is saying that, especially if you failed a previous step, by saying, I ran out of time. I was not able to read the last 5 questions or the last 2 questions, and I randomly had to pick C, or I didn't even have the time, and that's why I failed. Including that specific amount of detail as evidence of why you need extra time in the exam so you can actually get to the point that you're actually reading those final questions. And I've said a lot of things, so I want to pause and just take a moment if there's any questions, particularly on this idea of letter. And there's more that we'll go over, but I want to just pause because I've definitely thrown a lot of things.
One question about letters from therapists, etc. For example, in my package, my provider is a psychologist as opposed to like an LMFT or something. Do you think there might be additional benefit from getting an additional letter from an MD or DO?
Yes,
Okay.
100%. For some, I could say bias. I could say you're applying for MD. I could say the fact that maybe, I don't know, but it's possible the people that are reviewing these applications are MDs, DOs themselves, so they will trust them, their own colleagues versus another profession. For some reason, the people that are being denied did not have an MD or DO letter.
If I could ask a follow-up, would you say I have a psychiatrist letter who I've worked with very closely? But I'm wondering would you say more is more like, should I get my primary care physician to also write a letter?
The people that have more data, more
Mm-hmm.
support, are
Mm-hmm.
greater chances of getting the accommodations. I've seen people that even get more than they requested for 1.5, and then suddenly they're like, oh no, you need two times.
Wow.
And we're like, what? Okay, we're not going to say no.
Wow. Okay.
They're so inconsistent, is really.
That's so fascinating. Would you say that having one from a therapist or psychologist would be good, or just having more physician letters?
If you're talking about a medical condition and that's the reason why you're applying, it doesn't really make sense to have a therapist. But if you have a mental health condition, so
Okay, beyond
social
a
work,
psychiatrist.
counselor, psychologist, it doesn't need to be a psychiatrist. Now, having a psychiatrist is a really good way because they have that MDDO and
Right.
it can also provide what that neuropsych testing is for some.
Okay. I had a psychiatrist letter. Would you say then that the psychologist or therapist letter isn't necessarily at that much more?
Wouldn't say that. I would say it's additional benefit, but when we're talking about priorities, MDDO is number one priority. The reality is we only see our psychiatrists or PCPs at max once a month versus therapists we see more often. So by having the in the letter saying I've seen them for over 50 hours or I've seen them for years versus maybe the MD can only say I've seen them twice, that can also provide another additional benefit in view because they've spent more time with you. For me, I included both my psychiatrist and my therapist, and I was glad that I had been with my therapist since my first year of medical school, both before and after I was even diagnosed, before I was even had failed. So he was able to provide a really good perspective to share my continued history of struggles. These are really great questions. Anything else before we go forward?
One more question. When I applied for accommodations for the MCAT, I asked for originally time and a half going through my undergrad, and I still get it right now here in med school. But for that exam, I was denied the time and a half and was only given extra break time. Would including that hurt me more than help me, the accommodation letter from the MCAT?
No, it sounds like it would benefit you. It's that challenging thing that they have multiple people reviewing these. There are some people more willing to give certain things. There's not a set criteria, and that's what makes it
Mm.
so subjective. Like I've now talked to individuals like advisors in accommodations that have been like before even I was receiving accommodations, and they've told me that there is at least one individual in the group that does not believe that ADHD is a disability. So whenever someone has ADHD, they deny it or they give them less. And so those people have to put even more resources and more evidence. So, yeah, it's a challenge. I asked for this. Oh, I'll give you this. But that doesn't mean during COMLEX 2, you can apply again for this, especially if you have the evidence that this worked before, or let's say you're applying for COMLEX 2 and then COMLEX 1, you failed. You can use that fact that, like, I did time break and I still failed. This is why I'm applying again. That's what I included in my step 2 accommodations. I only had extra break time and I failed twice. If I had time and a half, I would have passed my first time. They did not give me time and a half. They gave me time and a quarter. I did not fight after that. I was like, I'll take time in the quarter. Fine.
Oh, okay. I'll put her as this. I can talk about how the accommodations helped, but they were not as helpful as maybe we see in the full time. So still running out of time on the exam. And in terms of just to reconfirm, we discussed getting a letter from an ND, a neuropsych, a previous MD psych letter, and 2 other nurse practitioner psych letters. Where would be best to get an additional PCP letter?
Sounds like you already have one. The MD, a psychiatrist, is an MD, as long as it's the
Right.
MD psychiatrist. The
Mhm.
only one that it would be beneficial to have a PCP is if the PCP is providing medications that the psychiatrist is not, providing medical support for the physical manifestations of the mental health condition. For example, anxiety can be long-term treated with an SSRI dosed by the psychiatrist, but you also the physical like actual anxiety panic, the PCP can give you propranolol, the beta blocker, to lower your heart rate right before the exam. And so it'd be beneficial, whoever's prescribing each of those medicines, to have their letters because it's their own perspectives of you.
I have questions about a few years ago, there was a court case that NBME lost after denying someone accommodations that were reasonably applied for Ramsay versus NBME.
Can you give me the dates? Because I can go
I
back.
think it was 2020.
Do we know if NBME has substantially improved in their granting of accommodations since that?
I wasn't a med student before then. I started in 2019, so I can just say from my experience of I first applied to accommodations when I was a second year. So it must have been 2020 is when COVID hit. 2021, I must have been 2021 when I applied. I've now helped from my own experience and also helped individuals since 2021. So I only know, hopefully they're better. I wouldn't say they're the best, but maybe they're a lot better than they were. I would hope.
But I think that's where the data comes from. The public decision on that one, because she didn't settle. That links the lack of granted accommodations very strongly to failing the boards.
Yeah. Yeah. Which, yeah, definitely by including the failure, I've definitely seen from myself and from other people that have failed on their own board exams without accommodations or enough. That is a good enough justification to say, okay, you need more accommodations because it's their own exam. We good to move on to the next one? Cool. Let's see. I've gone back and forth with this concept of how I've tried to address my own struggles. This is to show that you've done everything already in your power. You've gone to therapists, you've gone to doctors, you've tried tutoring, you went to courses, you took a leave of absence. These are all examples. You've tried medications, therapy, yoga, mindfulness. It shows that you have done everything you have done. You're not just like blankly saying like, oh, I have this need, you should help me. They like that you show a little bit of like ownership of I've tried to do something versus the applicants that I've seen that just submit their applications of just like, here's my problem, this is why I need it. They do like that, well, what have you done to try to surpass? And then this one, you can really also include this one before the other one. And this is where you want it, this is where the meat is. How does your physical or mental disability or health condition impact you? And not just testing environment. They really like the holistic of personal life, academics, so school, and then specifically testing environment, because obviously you're going to the testing center to do the exams. So that is definitely the most important because that's where you're receiving the accommodations, but they like also the holistic, that this is not just a one-time thing. This has come up in other evidence. Evidence is really how to describe it. And it is for the above reasons. This is where I said I was going to give some examples if you haven't thought of them. Extra break time, which really is just double break time. Shorter testing blocks. Ooh, this was a new one, honestly. They offered it to me for step 3. I did not ask for it. because there's this opportunity for you to actually say, just give me the exact same ones I received less testing block, because I did not want to go through the pain of yes, no, maybe. I just put give me the same ones. They returned it within 2 weeks, which I was so impressed by. But even then, they said, would you like to just split it up? So instead of the blocks of 40, they offered it blocks of 19 or 20. I can't remember if I chose to. I actually don't think I did on my first step 3 take. However, on my second step 3 take, I was like, you know what, I'm going to do it this time around. And if it comes to the point that I need that 20 questions, break, reset for 30 seconds, and then do it again, maybe it'll help. And so I did it this time. So we will see. But it definitely felt better. And then I could choose, oh, I could keep going or I can take a break now if needed, which is really helpful for my physical health condition that like randomly I need to go to the bathroom like now. So that's helpful for me. Extra time testing dates. Step 2, because it's 1 block longer than step 1, they can split it up. But I think also step 1 they can. And then here's some other ones. Separate room, ability to bring water, slacks, meds in room. This separate room, I feel like doesn't often get accepted because not every building even has a separate room. That has been a challenge. But sometimes there's like smaller ones that it's like 10 people versus like 20 people. And then like having your medications. There's so many things. I forgot to include lactation. So if you're currently lactating, I've definitely had people do that. There's many different things. These are the most common questions I receive all the time. 1, will residency see if I received accommodations in med school? No, they won't. What about, will the residency see if I got accommodations during STEP or COMLEX? No, they will not. They will just see your final score and if you passed or not. Do I have to have a neuropsych testing? No. Will it help? Sure, why not? If you don't have any in your city, like I remember when one of my friends tried to get one and she had to wait 1.5 years to be able to get one. She's like, I have to take step in 3 months. I'm not waiting 1.5 years. Maybe that'll help for step 2 or 3, but I need it now. We already talked about this, a letter from doctor. They love their medical providers. Letters from those providers. So we already talked about who they are. This is things that it's helpful. I've definitely had 2 types of providers. One provider that's like, they got it, they want to write it. And then I've also had the providers that are like, I don't know what to include. Can you just write it for me and I sign? So the ones that is like that, or if they want specifics, tell them specifically, I need you to say what my diagnoses are, include the codes, and what symptoms is it causing me, and specifically during my exam. And I've also had both types of providers. I don't think your problem is enough to need accommodations. If you have that type of provider, take that as maybe they shouldn't be your provider and get a new provider, a new doctor, because that is just so disrespectful. And I've had that. I had it on my first year of medical school when I was still trying to figure out what type of thing was wrong with me. They said, oh, you're just medical student anxiety. I didn't go to them again. Okay, so specific criteria. Okay, I'm gonna do PNES. Let's do ADHD, just because that'll be the most common. Oh, fine, we'll do major depressive. Okay, so here's the actual DSM. And yes, I'm a psych resident, so I have to have this. And this is like amazing. Anyway, you see that the DSM, and you can just look up on Google, has every single criteria, A, and then has like 8 different types of options. They love when you say criteria A, patient, for this example, 5 or more of the symptoms present in the same 2 weeks period. And then I did colon, and then I put my specific dates that I was depressed, for example. And these were the specific symptoms I had. And then I include which ones I had. Let's say insomnia, fatigue, feeling worthless, reoccurrent thoughts of death. We need to have 5, psychomotor retardation, marked diminished interest. And then I say how this impacted me and that because of these, I couldn't study because I was not sleeping well, because I had no energy, because I couldn't concentrate on my U-World, on my NBME exam, practice exams. I was too suicidal, so I couldn't motivate myself to keep going to study. Does that make sense? They are the ones who asked me this. I am not this smart to know that they would know this. During my step 2 exam, when I asked for extended testing time, they responded, we need to see specific DSM criteria and break it down of specifically how you individually need each individual one. I am so thankful whoever was the person who read my accommodation because they gave me that option. Most of the time people just deny them and don't explain why. So this is why I've been trying to educate everyone I can. If it's a mental health condition, go to the DSM and write it all out. A lot of times your doctor has no idea, so you have to provide them your personal statement that you already wrote so they can actually just take those examples so it's compares. Like you say in your personal statement, you failed step 1, and they can put in the letter, they failed step 1. So they say the same things. This shows that you care about your health and that you've been trying your very hardest. And this is why you need accommodations, because it's not out of you not trying. Any questions on those letters?
For those of us who are hoping to take COMLEX and USMLE as well in May, when would you recommend the absolute date that we need to have this in? I know we're already in October. From your experience with them, given that there's like an appeal process too, what would you recommend so that we can all make sure that we've done this?
That's a really good question. I didn't even think to include this in my PowerPoint, and I should have. Usually, it's 60 days for them to give you a response, whether we need more information. Easiest, you're approved. Second, we need more information. 3, you're denied. You can, appeal. 60 days. Let's say, for example, your exam is the first, you want to hit it by the 1st of February. So that means 2 months before, all of January, all of December, that means the 1st of December, you should be submitting your accommodations for February. Now you make an amazing point. What if you get the option 2 or 3, bump another 2 months? And it's sad. But yeah, 4 months before. And also the reality is, because that's when you're been accepted for accommodations, not when you're going to be ready to take it. And the thing is, when you go through that exam, please do not take the exam until you've passed by a significant amount the practice exams, because that was my mistake. When I failed my USMLE 1s, the first time I failed, I did not pass a single one. I failed by 1 point. The second time I tried it with the break time, I did pass a couple, but not all of them. They moved up the passing score. So again, I failed by 1 point. I had passed if it was back in the previous, if it was still in the 214, but at the time I did it the second time, it was 217 was the passing score. So, and it's weird now with this pass-fail situation. So like, when we knew the scores even more, it was 10 points over passing. Now I like to say a standard deviation beyond passing. And you will see, it will say when you do the practice exams what the standard deviation, then you get to practice statistics of what the median is, it's what I've noticed about all these exams. The passing score is usually 2 standard deviations below. Not all the time, but usually it's 2 standard deviations. So if you pass, try to be at a standard deviation of a -1, because a -2 would be passing. So if you can hit a -1, that's an increased chance that you're going to pass. And then that can bring in all, no matter what happens that day, anxiety attack, whatever happens, you have that buffer zone. Any other questions on that?
One thought I've had regarding letter organization is color coding or putting little footnotes next to every element that satisfies diagnostic criteria or the specific things that I think they're looking for. I also include a table at the end.
Cool.
That
I've never
makes that
seen
more
it. Really interesting.
viable.
Yeah, you're still including the data, just make sure it's easy enough to follow. It sounds like a good idea. I know this is in the future, but you have the ability to ask for accommodations when you're actually sitting for the interview. At that point, we don't know if it will be when all of you are M4s, if it will be in person or virtual still. So things to know that it's a good idea to ask for accommodations if you need to. And then this one I like to think in general is disclosing, especially as you all move into your third year, whether or not to disclose to a patient when you're speaking to your attending, your residents, or applying to residency. I like to think of it as focused disclosure. Ask yourself, what is the specific purpose of am I doing to help myself feel better, or to actually help, if it's a patient, their situation? Or is it an attending? Actually, am I providing information so they can help me be a better medical student? So always think, what is the purpose? I frequently struggle with this. I felt like I was more explaining or justifying myself when we don't need to. We don't need to justify our need to be here. We deserve to be here, and we just need additional support, whatever that means. Laws and protections. Know that when you're applying to residency, it is protected, so they're supposed to provide it. Now, I have met with a resident that they did not follow the ADA, and that's a whole nother thing. She is no longer being in that program, but the majority, that is the law. This is also questions if you are applying for residency, whether to not ask. And once you're in that position, I have another video that I presented at the LMSA that I really focus on this part of disability and applications. So you can see that on my Life as a Patient Doctor podcast or on my YouTube page. Things to look for in a program, like I said, it's already, since this doesn't apply to this specific thing, but also like as you start looking of like what specialties to consider, in general, it is more than non-surgical specialties. Right now, today in 2025, hopefully that will be different in the future, but right now, more than non-surgical specialties are more holistic, see people, and residents as humans. Okay, I want to finish off just saying why we need you. Just to reconnect, we will have patients coming to you no matter what specialty you'll be in. You will be very needed and appreciated, whether it's an invisible disability or a visible disability. Your perspective matters. From your own experience, you'll be able to help your patients overcome barriers just from your own experience. You don't even have to disclose that you have that experience. It's just that knowledge you will have through undergoing your own medical mental health process. And really, I like to say it because there is a societal picture of doctors as perfect and doctors as a like superhuman. So it is really nice when we can support in the concept of we're just humans too, and that it is normal to struggle and human to have needs. From the medicine perspective, it's also a huge benefit to teach our colleagues, teach our co-medical students, co-residents, that we're here, that people are all human and everyone has needs. Maybe they don't realize they have needs, but there will be a point that they will have needs. And so it's important to show that it is okay to have those and to get support. Apply for accommodations early. We mentioned that. You are needed. We talked about how to write your personal statements for your accommodation and what to include in the letters. We also briefly touched on how to disclose to others. And then, did I include? So this is common ones that I found. So MSDCI is medical students with disabilities, chronic health conditions. So I really liked them. One of the things I really liked is this Ask Jan, because a lot of people, especially if you haven't had accommodations in the past, they're like, I don't know what to ask, especially when you get into clinicals or residency. Ask Jan allows you to search by your health condition, and it provides ideas of what you could ask for. I really like sharing those. I created a disability resource page. As I was learning about it myself, I have like a section of all these different books, all these different podcasts, all these different support groups. So like all these different things, but like that one goes directly there. Thank you. This goes to my link tree. If you screenshot it, there is an area that's apply for USMLE or COMLEX. So a lot of the stuff we just talked about, but if you want a blog post of it all written down and with a video of me kind of going through it and explaining it is on there too. And then also on there, I include my most popular blog post about failing USMLE and what lessons I learned, lessons from third-year rotations, and lessons I learned from applying to residency. So hopefully all the different stages is helpful for you. And then I said I was going to include this at the end. If you have any friends that took a leave of absence, this goes straight to an email, so you can email our research group that will send you the link. Originally we were going straight to the link and got tons of bots, so now we go straight to the email. To make sure we don't get even more bots, it's best if you email from your school account, because that helps us know you're a real person. Thank you so much for listening, and how can I help? What other questions do you have?
Thank you so much, Dr. Moss. That was incredible. Your slides are fantastic. And thank you for letting us interject and ask questions during as well. First question for the personal statement, what length would you recommend? What should we be shooting for? Because I don't want to overwhelm the reader, but I also don't want to underwhelm them.
More than a page? I can't tell you what the limit is, because I've seen someone who done like a 40-page thing, not the personal statement, but everything, including the letters, like the full application, 40 pages. And I do want to say, they got everything they asked for and more. No, I don't know how they did that. There must have been some serious ChatGPT, or I have no idea how they did that, but they got what they asked for. So I'm not going to encourage everyone to do that, because I don't even know if I could. That's pretty much a novel at that point. But the more you put information, the more you share evidence, the better. But definitely more than a page, because I've definitely seen people that just do the one-pager thing, and no, not enough. So maybe aim for the 3 to 4 pages. The common amount, if you mention all those different aspects, ends up being about 3 pages.
One thing I've heard conflicting ideas from some people in psych residencies is whether you should disclose any disabilities or health conditions that during residency interviews.
Yeah, that's a whole, like I could talk on this for an hour, but the long story short, I also struggled with that concept because I also got similar no's and yes and maybes. When I was applying, I went directly to the head of APA. The president was there, and I literally bombarded him as he's going up the escalator. I was like, so I'm applying to residency. I have this question, exactly what you just said. And he responded, I have yet to find a residency applicant that has that, or no, sorry. I have yet to find a psychiatrist who doesn't have their own needs. And that's it. Then he kept walking. And I was like, I don't know if you answered my question, but okay. I've written in a couple blog posts and talked about this. It's all about the pros and cons, where you disclose, in your personal statement, on the ERAS, and in interviews. Do you just do the program director? Do you do every single attending that interviews you? It's such a complicated question. Hopefully that at least starts a little bit of the answer, because every program is different. Any other questions or things I can support with?
Question to like a ADHD, like at least time management. Yeah. Resources outside of the accommodations work on our own part, where you mentioned that we can find stuff like that on your website, or what are things that you've...
Yeah. So I don't have ADHD myself.
Right.
However, I have a lot of really close friends that had ADHD in med school, and I have co-residents who have ADHD. And the things that I have found from that they've told me, because I asked this question a lot to help others, is learning the prodromal method, the set amount of time, and then break away time that you're going to actually be tested on. If you get the half questions, the 20 questions, I think it's 40 minutes. So 40 minutes, then break. 40 minutes and break. That practice of being able to sit and focus and then move away is the most beneficial, because that's how the test is in real life, and then also helps train your brain to start working that way. The prodromal method, having actual timers, following a pre-written schedule. There's so many apps out there that can help build out your schedule to make sure you're actually because when individuals have ADHD, just dates just come up on them really quickly. It's more challenging to make those schedules and follow those schedules. Having an app that does it for you and helps you, so you also don't have that freeze moment of I don't know what to do first, of it saying this is what you're doing today. No ifs, ands, or buts. You're doing this today. Really just took the same thing that's on my blog post, and also people can purchase my accommodations workbook that actually helps you go through what we were going through, and then it also shares my full accommodations, like my personal statement for step 1 and step 2, which is the same as step 3. Because
Yeah,
thank you so much for
I
inviting
think you
me.
made
Good
a
luck, all of you. But that's literally what I do. The reason I do what I do. Why is the hand still up? I need to turn off that. Hello, goodbye. Okay, we're gonna keep that hand up, I guess.